My name is David Carter, and I participated in the diabetes program. It was a program geared to inform and kind of let people understand better the disease and how to cope with it. After I was diagnosed, I was speaking to my general practitioner, and she said that she had heard about the program, that she had not taken it, or she did not know anyone who'd taken it, but she suggested it. So I looked it up and found it on the Google by Googling and contacted Catalin, and she said, absolutely, we'll put you down. It was that easy. Well, the biggest thing is that, just being diagnosed with diabetes is kind of it just bothered me, and I wanted to understand, what it was all about and how it affected me, and what I could do to have, if you will, an impact on trying to minimize the condition. And frankly, I had an in-law, a father-in-law, who essentially died from diabetes, and I didn't want to go the same route. Well, to start with, when I started the program, yes, I knew I had been diagnosed with diabetes, but I didn't know all the symptoms, the things that were good, the bad, what I should do and shouldn't do. And I was just kind of in shock, so to speak, being diagnosed, and I knew I needed to understand it in order to control it. So the class was extremely organized. Every week, Catalin sent out an agenda with handouts, and it was great. I mean, it was just everything that you needed. My biggest challenge was not understanding the things that caused my blood sugar to go up and down. Oh, I knew that if you had a candy bar, that would be a problem, but I didn't know that all the foods that you were eating was going to have a major impact. And we went over those things. We went over the types of triggers, not just food, whether it was alcohol use or certain medications like prednisone is a drug that I have to use occasionally, and it really sends my blood sugar way high. So these are things that Catalin covered, and handouts and all the things that she sent me, I put in a binder, and I refer to it often. Something just as simple as thinking before you just grab something to eat. Is this something that's going to be good, or is this something that's going to cause your blood sugar to go up? And trying to modify your behavior. Like, for example, instead of having that candy bar, maybe have an apple or something that has natural sugars instead of the things that's going to send your blood sugar way over the range. So yeah, I've done that, as well as things just like how often I test my blood. I wasn't testing it enough, and now that I've started testing it around meals and stuff, I can see things that cause my blood sugar to go up, and those things I try to eliminate from my diet now. I tell them that you can't go wrong with this program. I mean, look at it. You've got a very well-organized, knowledgeable individuals that are conducting it. And they're there to help you, and it's not just a class. I mean, there were several times when it was individuals that Catalin was dealing with. She called me on a couple of occasions and responded to questions, and all of this, and the cost is zero. What a deal! Where do you get a bargain like that? When you think about it, if you were to go through your insurance company, they could find somebody that might have a class like this, but it would cost real money. And this was a program that was offered just to help. And like I say, it's a no-brainer.